Mr. Carter is recognized for 5 minutes.
Thank you. I'm down here in timeout, so y'all focus down here. I appreciate it. Thank y'all for being here. This is a very important hearing. These are very important bills that we are considering. And you know, many of these bills, if not all of these bills, are bipartisan. And I think when you look at it, and I'm a healthcare professional, a pharmacist, and you know, we all want the same thing in healthcare in America. We want accessibility, affordability, and quality. All of us, whether you're Republican, Democrat, or Independent, you want accessibility, affordability, and quality. That's what we want. That's why I'm glad that we are having this hearing today, particularly as it relates to children. And I've got a bill here, a bipartisan bill, the Emergency Medical Services for Children Reauthorization Act. It's extremely important. All of us love our children. We want to make sure that we are taking care of them. That's what this bill does is it reauthorizes grants that focus on addressing the unique needs of children. And we know that they have unique needs, particularly in emergency medical systems. You know, for nearly 4 decades now, the Emergency Medical Services for Children program has been the only federal grant program that specifically focuses on addressing the needs of children in emergency medical systems. That's why it needs to be reauthorized. Mr. Strosik, I wanted to ask you, can you explain how the needs of pediatric patients are different from adults and why it's so important for local and community hospitals to be ready to meet the needs of children?
I think, and Dr. Schreier can attest to this, children are not little adults. And the level of training, both at the EMS field for the first responders, be it paramedic or EMTs, understanding the physiology, the level of care that a child needs, as well as recognizing that children don't necessarily respond in the same way as an adult was. I'm not saying that we cry faster than a child if we skin our knee, but these things do occur. Equally true is when that child is taken to a community hospital, an initial level of care, it's that recognition and training that is incredibly important by those physicians and nurses at that facility to recognize that that child may need tertiary level care. And in our state, it's going to Children's Hospital, Mary Bridge, or wherever it may be. We have grown this level of care over the last few years, my last 40 years, from treating them as little adults to really recognizing many of these efficacies, including mental illness.
Exactly. Thank you for that. Extremely important point, and I appreciate you bringing that up. You know, I had as a pharmacist, I dealt with nursing homes, geriatric patients, so I had the other end of the spectrum. But you're absolutely right. With medications, they're not the same for children as they are for adults or as they are for geriatrics. That's why this is so very important, particularly when we're talking about emergency situations. Because I want to get this in very quickly, I'm going to change and shift gears here and talk about another bill that we've got here, and that is I'm co-sponsoring the National Alzheimer's Project Reauthorization Act. And I believe that Dr. Pike, you discussed this in your testimony today. I'm optimistic about this and about the FDA-approved treatments to slow the progression of this awful disease. As I mentioned, I worked in the geriatric world, and I've seen this. I've seen it firsthand, experienced in my family, as I think probably all of us have. You mentioned that, Dr. Pike, you mentioned that the National Alzheimer's Project Act has led to much of this great progress that we've seen. Can you elaborate on how the national plan has laid the foundation for these and future scientific advances?
Yes, and thank you for co-sponsoring our Reauthorization Act on this. Before 2011, there was no cohesive national plan to address Alzheimer's disease in this country. Thanks to NAPA, the first ever national plan to address Alzheimer's disease was released 12 years ago, which focuses on the goals to promote rapid research on Alzheimer's disease, certainly on other dementia as well, and improve the delivery of clinical care for services for individuals who are living with dementia and also their caregivers. It provides a roadmap of strategies with HHS and its partners so that we can accelerate research. Within the last 10 years, since we have been working within the Advisory Council and the NAPA Act, we have learned quite a bit as a result of this national investment. This reauthorization gives us the opportunity to take that knowledge and build on it and make the updates to the NAPA Act along with that. So for instance, including risk reduction. The science continues to evolve on that, and we learn more.
Well, good. Thank you for that. And I might add, I've been back and forth between a budget committee hearing and this hearing, and the impact, the fiscal impact that Alzheimer's is going to have in the future on our budget here, that's another thing we need to take in consideration. The physical effects, the effects it has emotionally on families, on the caregivers and everyone else, yes, but the impact financially it's going to have on our budget, that's another thing we have to take in consideration. So thank you for your work in this. Thank you, Mr. Chairman, and I yield back.